Meniscus repair surgery. How successful is it? Unfortunately, over the last few years, we've seen an increase in the amount of meniscuses that are stitched together to try and repair them or save them. Just to recap, you have a meniscus, which is a cartilaginous substance that's between the top bone, the femur, and the bottom bone, the tibia. It's a shock absorbent type of rubber substance. And often patients, when they damage this, be it through a sporting event, it could be a degenerative tear that occurs with getting older. Often these patients will go to see an orthopedic surgeon, and the orthopedic surgeon will want to stitch it together. It sounds plausible. Let's try and save the meniscus rather than cutting it out. That's what you'll be sold. And they're right to one extent, that we want to try and maintain as much of this cartilage or this rubber substance in between to protect the joints as you get older, because that's what its function is. However, if I was to say to you that in a very high percentage of cases, trying to stitch the meniscus, not only does it fail, the stitches fail, but in a very high percentage of cases, it actually produces collateral damage, it would make you think twice about this procedure. We definitively know that there's a number of different sorts of tears that do badly with stitching. We also know that the stitches that are put in there don't dissolve in almost all the cases, and they stay in situ, or they stay in your knee joint until you pass away. They could be in there for 20 to 30 years. We know, for instance, that if you have a bucket handle tear, as the name suggests, it's like when you pull up the handle of a bucket. That's what the meniscus tear looks like, a bucket handle tear. In 70 to 80% of cases, if these are stitched, they fail. With a horizontal cleavage tear, which is pretty much a tear through the meniscus, and if these are stitched, 70% of these will fail. If you have a complex tear, which as the name suggests, a lot of little tears, they're very difficult to stitch together and again fail. So what ends up happening is that patients go and see the surgeon. They will usually say, we'll decide when we're in there what sort of procedure we're going to do. If we think it needs a stitch, we'll stitch it. They can sometimes say, well, they'll try and trim it. However, we definitively know that trying to stitch most meniscus tears produces poor results. To give you again a bit of background, the meniscus is 2/3 avascular. It doesn't have a blood supply. Stitching it in that area doesn't produce great results. We also know that the stitches that are put in, if done poorly, often will come loose or can actually irritate the bone above. So if you've got a meniscus repair here, the stitch sticks out, it can rub against this bone on the top. And so not only do these stitches often not work, but they then produce what we call collateral damage, or damage to the opposing surfaces, in a very high percentage of cases. The take-home message: if you have a meniscus tear, in the vast majority of cases, stitching it produces very poor long-term results. One of the reasons I think meniscuses are stitched together regularly in Singapore is that the general patient population that see a lot of specialists here are a sedentary population, meaning they won't go back to a lot of activity. If you happen to be a 45-year-old female who is very sedentary, that doesn't do a lot of activity, perhaps in that situation it might be plausible that it may protect the joint if it was in the right area where the tear occurred. However, in my patient population that I see in our clinic, most of our patients are fairly active. By having a meniscus repair, they want to go back and play soccer and run and so forth. And in this patient population, the results are catastrophic with meniscus repair surgery. So again, err with caution. We need to be aware that they have a high failure rate, and in most situations we would recommend people get a second opinion to determine whether this is the best operation that is required for you. Thank you.